The next question I want to spend a little bit of time on because it was a very common question. Dr. Ratagi, I actually might ask you to comment first, as well as Dr. Rogers and others if they'd like to. But the big question that came up often is the need and use of someone for oxygen at home, and what thoughts and recommendations we can have along that. I know many of the doctors on this webinar have had multiple regular conversations with doctors in India about this issue. What practical considerations can you recommend or say about this?
Thanks, Dr. Zalga. I think the first consideration, as Dr. Barman mentioned, is that reading accurate or not? Second, as all of us are mentioning, is that it's very important to see how the patient is feeling and looking. That is much more important than the number. There are lots of difficulties getting oxygen in India, and I would also want to emphasize that we don't have to be 100% on the oxygen. 90% is okay. If the oxygen levels are dropping quickly or the patients are feeling worse, those are the things that worry us most than the oxygen level of just 100%, 90%, or 96%.
Thank you. Dr. Rogers, can you also, any additional thoughts?
Yeah, I wanted to just acknowledge that what we're talking about here about asking people to take care of people on oxygen and watching them, especially if you're not a medical expert, is really hard. And we want you to know that our hearts really go out to you. We know in the United States, there were hospitals that were also really stressed and the feeling that you couldn't give the care you wanted to because of a lack of resources. And you're in such a terrible position trying to give the best care to your loved ones when the home is not the ideal place to go when you have a new oxygen need. But I agree 100% with Dr. Rohatgi that if the oxygen is 92 and the person looks good, that is good enough for me. And so you can have the oxygen last longer by targeting those lower levels. That's what we do in intensive care as well. We do not need to see high 90s. I know that on Dr. Rohatgi's site that she has posted that there are instructions about proning where you spend a lot of time lying on your stomach. And I can say that even in intensive care unit, we found that there were a lot of patients whose oxygen got markedly better when they were in that position. It just improves the place where the gas is going and your blood is going and seems really helpful. And so we had patients that almost needed a breathing tube. And if they just spent a lot of the day on their stomach, their oxygen levels were better. So I think that's definitely something to try. And then the final thing that also Dr. Barman mentioned is that oxygen levels do drop when you walk. And so if someone is really teetering, very, very sick, you can't get them to a hospital, they're in the 90s, trying to limit the amount of things that they have to do physically, they will be lower when they're walking than they are when they're lying. And so as much as possible, if someone can get them their things and limit that, that would be good. And if they happen to have CPAP at home, if they have other medical conditions where they have those machines and have a mask that fits, again, it's not ideal. If there is a hospital you can go to, it would be much better to be with someone who can watch. But that is a strategy that is used in many countries, even for people in a hospital. We tend to use something called high flow, which wouldn't be possible, but that will usually get you some extra time and get a little more oxygen in.
Great. Dr. Maha, could I ask you to comment as well?
Yeah, in addition to what Dr. Rogers is saying about proning, in addition to laying on your stomach, you can also lay on your left side or your right side and actually rotate those positions. And that's been found to be beneficial as well. And as Dr. Rogers is suggesting, you're recruiting different parts of your lung to be useful, and people tend to feel a lot better, and their saturations tend to rise even without getting oxygen applied.